I kept saying, something's bad with her. She's not normal.
I just thought that was the last time I was going to be able to hold her.
My first thought was, if they don't get to me in time, that could kill me.
I didn't know whether it was, could be fatal or not.
Next, two medical mysteries that defied the experts. Since the day she was born, Hannah Hannum has endured a bizarre constellation of symptoms that no doctor can explain. And it isn't long before her mother is forced to face a terrifying reality.
She just collapsed completely over. I was so numb and scared. I felt like I died.
Then, Carly Eichhout's seemingly perfect life is turned completely upside down by a series of debilitating and potentially life-threatening attacks.
The last thing I remember was the stars, the bright stars going in my vision field, and then the blackness.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the fall of 2000, Holly and Mark Hannum were living a seemingly ordinary life with their 7-year-old son in Pittsburgh, Pennsylvania. They were all happy, healthy, and thrilled to discover that Holly was pregnant again, this time with a baby girl.
I was really looking forward to pink outfits, the pink room, just frilly pink girl things.
She was very, very excited because when she found out she was pregnant, that's what she hoped for. I hope I have a little girl.
After an easy pregnancy, in 2001, Holly gives birth to a healthy 9-pound baby they name Hannah.
She was a beautiful little girl. Beautiful. Me and Mom couldn't get over how pretty she looked.
Over the next 2 years, Holly, a stay-at-home mom, enjoys raising her children and watching them grow.
Everything just worked out like it should, as a family should. 2 perfect kids.
On Hannah's 2nd birthday, her mother has her professionally photographed to mark the special occasion. But when she sees the final prints, Holly is taken aback.
And when I picked him up, I was shocked. I said, look at this picture. I said, she just, to me, looks like she has Down syndrome. She just had the cherub look in her face, just little up corners of her almond-shaped eyes.
I said, Holly, I said, you know Hannah. I said, there's no way that she could ever have Down syndrome.
Holly soon becomes convinced that she's overreacting and does her best to ignore it. But then, about a month later, she notices something else unusual.
When I went to put her pants on, I noticed that she had this bruise on her leg. It was cobalt blue in color, and it was approximately the size of a silver dollar on her right shin. Right away, I'm thinking, okay, what was she doing? Did she fall? That's an awful big bruise.
It was like somebody hit you with a ball batter or somebody threw a stone at you, and it was a funny colored bruise.
At that point, I wasn't concerned to call the pediatrician.
But several weeks later, the bruise still hasn't gone away. And Holly figures she'd better get Hannah to the doctor, just in case.
He said to watch the bruise and we'll see if it fades. But nothing to worry about or medicate her on.
2 more months go by, and the bruise remains clearly visible. Still, the Hannums don't give it too much thought. Otherwise, Hannah seems perfectly healthy. But then, the little girl comes down with an awful case of the flu.
She caught whatever flu was going around, and it hit her hard. She had a fever and got a little bit of the runs. She just had this purple marks under her eyes like she hadn't slept in days, just really sick.
Worried, Holly puts in another call to the pediatrician. He isn't too concerned, though, and assures her that the fever just needs to run its course. But 3 weeks later, the flu is still wreaking havoc on Hannah's body. And when her temperature spikes to a dangerous 103 degrees, Holly rushes her daughter back to the doctor's office.
And when he listened to her, he said, her lungs are clear, so it's definitely the flu. So he says, go home, rest, liquids, just keep her comfortable.
For the next 2 weeks, Holly keeps a close eye on her little girl, but Hannah doesn't seem to be improving. In fact, the family begins to notice an alarming new symptom.
She was always pale looking and tired, When she was at my house, she'd be in the bedroom playing and turn around, and the next thing you know, she's laying in bed sleeping. I kept saying something's bad with her because she's not normal.
She was still pretty lethargic and sleeping, and underneath her eyes, they were just purple, just like she had bags. And I knew she slept, so it wasn't like she wasn't in lack of sleep.
Over the next week, Hannah begins sleeping more than 17 hours a day. She also develops a runny nose and brutal cough. The seasoned mother now knows that something is very wrong and takes her daughter in to see the pediatrician yet again.
He looked at her and he says, "Oh, I think we're gonna put her on an antibiotic at this point. She has a little bit of a sinus infection building up." After a couple days with the antibiotic, she seemed to perk up.
But Hannah's rebound is short-lived. Just a week after completing the course of antibiotics, Hannah develops yet another raging fever.
That night, she had had 103 temperature. She was moody, she was pulling at her ears. She was just not at all happy. And I thought, this is just not right. Why is she doing so well on an antibiotic for so many days, and then boom, the minute she finishes it, she's sick again.
The following month, this disturbing pattern repeats itself over and over when Hannah comes down with an ear infection and then bronchitis.
I'd taken her to the doctors almost every week at this point, and it just seems to me that it's odd that she goes from one virus to another virus, one antibiotic to another antibiotic, and just back to back to back, and nobody seems to be concerned about it.
I felt Holly probably was being a little overprotective. I thought Hannah was a typical child who just was more susceptible to common colds.
After raising 5 kids, we didn't think what Hannah was going through was normal.
But the family isn't sure what to do next. While they suspect that something serious is going on, they have no real proof. That is, until a terrifying new symptom emerges.
I went to go get her after she chased the dog into the bedroom, and it wasn't very far. And she's like, "Mommy, I'm so tired." You know, and I thought, wow. I said, "You didn't run that far." And when I picked her up over and laid her on my chest, her little heart was just beating out of her chest like she ran a marathon.
Terrified by the possibilities, Holly races her daughter back to the doctor's office and demands an explanation. But nothing could have prepared her for what he has to say.
They just said, "Go to the hospital right now." I'm thinking, they know something and they're not telling me.
Panicked, Holly hightails it to the nearest hospital.
Pulled in the parking lot in the hospital. I got her unstrapped. I set her down beside the car, and I reached in to grab my purse, and she just collapsed, completely over.
Over the past 4 months, 2-year-old Hannah Hannum has been battling round after round of severe flus, fevers, and infections. But when her heart begins to race out of control, the doctor orders her mother to take Hannah to the hospital immediately. Now, the toddler has collapsed outside of the local emergency room.
And I picked her up, and when she was on my chest as I was walking into the hospital, her little heart was just beating out of her chest again.
The on-call doctor gives the little girl a thorough exam, but has no idea what could be causing the terrifying heart palpitations. He orders a round of blood tests, hoping to find a clue. In the meantime, Holly does her best just to keep it together.
My head was spinning. I was so sick to my stomach. I was shaking. I just wanted it to be over. I just wanted the day to go back and just start over.
20 minutes later, the doctor approaches Holly and walks her through the test results.
And he said, "Mrs. Hannum, your daughter's severely sick. Her blood count's severely low, and she needs blood right now."
Hannah is immediately admitted to the hospital, and the medical team begins to run a series of tests, hoping to pinpoint exactly what is causing the dangerously low blood counts. In the meantime, doctors continue with their physical examination, and it isn't long before they make a frightening discovery. Hannah's body is virtually covered in bruises.
They had this chart, and they just detailed everything on her. I mean, they went over her eyes, her ears, her mouth, and they started marking everything down. They said something about her back having an extremely large amount of small bruising on her spine and petechiae, and I've never heard that word before.
Petechiae are tiny red or purple spots produced by small hemorrhages under the skin. The most common causes are low platelet count, trauma, and viral infections. While the doctors can't explain exactly what brought all this on, they assure the distraught parents that they'll get to the bottom of their daughter's case.
It just felt like forever. When are they going to just get her medicine and make her better? When are they going to come in and tell us what's wrong with her? I just wanted her to feel better. Just play like a normal 2-year-old again.
The waiting is brutal, but the results are even worse. Hannah's lab reports seem to indicate that she's been suffering from a rare and potentially life-threatening blood disorder.
I was so numb and scared. I felt like I died. I don't remember anything else. I don't remember anything else.
The doctors tell the family that Hannah needs to be seen by a team of specialists at Pittsburgh Children's Hospital right away.
They tried to take Hannah off my chest and lay her down. I wouldn't let them. I just thought that was the last time I was going to be able to hold her. The whole ride up, she was asking, "Mommy, what's that? Mommy, what's this?" She was just apprehensive and scared. You could just see it in her eyes. And to take that fear away, I would have done anything. I would have just done anything to trade places.
She called us up and told her they was going to Children's Hospital. She was very nervous, very nervous. I think she was crying a little bit too. And Mom and I was really worried about that time.
And the ambulance driver said, "Now, Mom, if you're scared, she's gonna be scared. So you need to do your best to try to hold it in and smile."
As soon as Hannah arrives at Children's Hospital, the medical team immediately administers a blood transfusion to help raise her low blood counts.
I held her to my chest the whole time the blood ran. She fell asleep on my chest. I was able to lay her down in bed and kept rubbing her back.
4 hours later, Dr. Peter Shaw, a pediatric hematologist-oncologist who specializes in childhood blood disorders and cancers, takes over Hannah's case.
I was the oncologist rounding in the hospital, and I heard that overnight a girl was admitted who all of her blood counts were low.
He sat down with us for quite a long time.
I said, "I know it's very distressing having an ill child, and I have my own children, so I know what it's like when your child is ill."
Dr. Shaw knows that what he needs to do next isn't going to be easy for the Hannums or their little girl. It's imperative that he get a close look at Hannah's bone marrow to understand why her blood counts are so dangerously low.
We immediately prepared to do a bone marrow aspirate biopsy from her right hip, which is the best place in children to get marrow from, to get our answer as soon as possible.
Bone marrow is the spongy, blood-forming tissue that fills the cavities of bones. It's the body's blood manufacturing center, so if answers are to be found, this is the place to start.
It's essential to know what diagnosis you're dealing with to come up with the best game plan to come up with the best chance of cure.
The biopsy will enable Dr. Shaw to take a much closer look at Hannah's red blood cells, white blood cells, and platelets. But for a 2-year-old girl, the procedure can be terrifying.
In pediatric oncology, we almost always sedate because it is painful. We usually put the children either on their belly or on their left side, numb the area a little bit with some lidocaine, and then use a special bone marrow aspiration needle to go right in through the skin and the fat and then into the bone. And once it's anchored into the bone, take a syringe and use it to suck out some bone marrow.
Dr. Shaw sends the sample off to be tested. Now, all the Hannums can do is wait. But with Hannah's health and possibly life on the line, the anticipation is almost too much to bear.
It just felt like forever. You knew there was treatments out there for her, so give her something and let's get her home. It was like a nightmare.
After suffering through 4 months of extreme fevers, debilitating flus, and now random inexplicable bruising, tests have revealed that 2-year-old Hannah Hannum may in fact have contracted a rare blood disorder. Now, her family is anxiously awaiting the results of a bone marrow biopsy, which doctors hope will shed some light on Hannah's deteriorating condition.
That can be a source of frustration for families that we're holding off on therapy, but it's the best plan of action to shoot when you know what you're aiming at.
After an excruciating 4-day wait, the report finally comes in. And it doesn't take Dr. Shaw long to put the pieces of the puzzle together.
Hannah's unexplained fevers, cough, bronchitis, easy bruising, fatigue, all of that made us suspicious that something was going wrong. When we saw her blood counts that were all low, that led us to do the bone marrow aspirate and biopsy, which in turn led to the diagnosis of the myelodysplastic syndrome.
Myelodysplastic syndrome is a type of blood cancer. In healthy individuals, stem cells, known as blasts, mature to become healthy red blood cells, white blood cells, and platelets. But in patients with myelodysplastic syndrome, the blasts never mature and affect the operation of the bone marrow, preventing the production of healthy cells.
The cells start to develop as normal cells, and then a switch goes off in one cell that stops it from maturing all the way and becoming functional. It's like a photocopy machine going crazy. It tends to replicate itself over and over. It causes the bone marrow to shut down. It makes the body susceptible to a lot of different problems that are potentially fatal. The white cell count is so low, people who have it are susceptible to infections. In addition, when there's not a lot of red cells to pump around, the heart has to work overtime.
And I just kept thinking to myself, she doesn't have cancer. There's just no way. That's not my daughter. She's not gonna be sick. She's not gonna lose her hair. She'll be fine.
Thinking back now, but that time she told us back then, I was really worried.
I was devastated because we knew Hannah since she was born, and she was such a sweet, bubbly child. And when they told us that, we were totally devastated.
The Hannums are completely overwhelmed. And since time is of the essence, it raises the question as to why it took doctors so long to arrive at a correct diagnosis.
Many children have flu-like symptoms, and many children have bruising. So a lot of children go on for several weeks not being diagnosed. If you have a combination of bruising, frequent infections, unexplained high fevers for a prolonged period of time, then that merits further investigation. Myelodysplastic syndrome is very rare in children. It's much more commonly seen in the adult population. And most of what we know about myelodysplastic syndrome, diagnosis, and early treatment data all comes from diagnosing and treating adults.
All of this also makes it difficult to determine a precise treatment plan for Hannah. But one thing is clear, the clock is ticking. So Dr. Shaw goes with the one option he believes stands the best chance of working: chemotherapy.
By 6 o'clock that evening, the first bag of chemotherapy was hung.
We call it intensive timed chemotherapy because we give 4 days of very intense chemotherapy and then a week off. It can make children very sick for weeks, and they're at highest risk for dying during that time.
The next few days are almost unbearable for the Hannums as they wait to see how their little girl's fragile body takes to the chemo.
I thought as soon as she was attached to the IV, she was gonna start getting sick. And thankfully that didn't happen.
She really didn't seem to know that she was supposed to be sick. She's really tolerated better than any child I've ever seen.
But despite her uncanny ability to weather the therapy, Hannah can't avoid the most common side effect.
I lost my hair and I was bald like my daddy.
Still, the little girl takes the grueling treatments in stride. And 1 week later, she seems to be beating the odds.
Initial blood results were in and they were looking good, and she was feeling well, and she was handling it. Amazing was the word. She was just a trooper.
I remember that there was a playroom. It had lots of toys, and it had a TV and some dolls.
As Hannah's first round of chemotherapy comes to an end, Dr. Shaw orders another bone marrow biopsy to determine how well treatment is working. But when the results come in, Dr. Shaw finds himself face to face with a startling revelation, and one that will soon send the entire Hannum family reeling.
I was completely shocked.
Two-year-old Hannah Hannum has just undergone a second bone marrow biopsy to help ascertain the effectiveness of her last round of chemotherapy. But the results are not at all what Dr. Shaw was expecting.
We saw that 10% of her cells had an extra chromosome 21, which is what you see in mosaic Down syndrome.
Mosaic Down syndrome is a genetic disorder where individuals have a mix of normal cells and mutated cells that contain an extra chromosome 21, characteristic of Down syndrome. However, patients with the disorder don't normally exhibit the same physical symptoms or developmental delays as patients with classical Down syndrome.
He was asking me a few questions about her, and I mentioned that when we had her pictures when she was 2 years old, she looked like she had Down syndrome. And he says, "Do you happen to have that picture?" And then I gave it to him.
The more we looked at her, the more we examined her closely, and we saw that she did have the palpebral fissures, the creases in her eyes, which are seen in kids with Down syndrome.
I was completely shocked. What does this mean for her? Well, what can we do?
Dr. Shaw explains that children with Down syndrome have a 30% chance of developing some kind of blood cancer in their lifetime. With this information in hand, it's easier to understand why Hannah developed myelodysplastic syndrome at such a young age. But now, Dr. Shaw has to rethink his entire treatment plan.
Children with Down syndrome tend to not metabolize chemotherapy as well as other children or adults. In other words, they don't clear the chemotherapy out of their body as quickly. It's a double-edged sword. The cancer cells die off more quickly, but it can also lead to more side effects. In that same vein, they also don't tolerate bone marrow transplantation very well.
The options are extremely limited for Hannah, as additional chemotherapy might be too much for her body, and a bone marrow transplant could prove fatal.
They didn't know how to treat her now. Here we are with high-dose chemotherapy that she probably couldn't handle. We were going to take her to transplant like the doctors planned, but it could turn out to be toxic and not really good for her and kill her.
In a matter of moments, the family has gone from hopeful to distraught. But Dr. Shaw has one more trick up his sleeve. While risky, it's possible that a lower dose of chemotherapy may allow them to kill the cancer without killing Hannah in the process.
They're getting something to make it better, but it could also kill her. It was just one more thing to deal with, one more hurdle.
The next 9 months are the most difficult the Hannums have ever known. But in December 2003, Dr. Shaw gives the family the news they've been praying for. Hannah is officially in remission. Today, 5 years later, she remains cancer-free.
She finished her chemotherapy December 21st, 2003, and it's like we've never looked back. She's been fine and healthy.
I am cancer-free.
Now that she's around 5 years out, her chance of remaining in remission is almost 100%. Her chance of recurring at this point is really almost zero.
I feel pretty good today.
I see nothing that is holding her back due to her having the Mosaic Down syndrome. She could do everything a typical 8-year-old can do. She loves to read. She's a great kid.
Hannah's nice today. She's a very beautiful girl.
I don't think as an adult I could have gone through what she went through and come out smiling as she did every day. She's an amazing little individual. She is my hero.
While Hannah Hannum's illness struck quickly with little warning, Carly Eichhout's harrowing condition seemed to gradually take over her life, one symptom at a time. In 1999, newlyweds Carly and Nathan Eichhout were busy starting their lives together in Phoenix, Arizona. As a customer service rep and contractor, the couple worked long hours to make ends meet, but still managed to find time for each other.
We would take the dogs for hikes up the mountains around here, hang out by the pool, go out, have drinks, comedy clubs.
It was romantic and fun at the same time.
Life is seemingly perfect, until one morning when Carly is caught off guard by a strange sensation.
I started feeling very nauseous, like I'm gonna throw up. Just kind of stood there trying to breathe really deeply and get through it. I think my first thought, being a female, was, am I pregnant? Because it happened in the morning.
Excited about the possibility, Carly picks up a home pregnancy test.
And I remember the hardest part was waiting. And I just wanted to know right away, and I wanted it to be positive. So I was disappointed when it was negative.
Carly doesn't mention any of this to her husband, but over the next few weeks, she continues to wake up feeling nauseous, and eventually Nathan begins to suspect that something is up.
It seemed like she wasn't being her full self at that time.
Then, when an agonizing new symptom suddenly emerges at work, Carly can no longer deny that something is very wrong.
I was sitting at my desk and I just felt like a spasm in my abdomen that kind of jolted me. It kept coming back like a couple minutes apart, where it was just like this spasming, cramping pain.
I definitely knew that something was going on. She was clutching her desk.
Carly finally relents and decides to see a gastroenterologist. He performs a thorough exam and quickly comes to a diagnosis.
My doctor immediately felt that I probably had acid reflux disease, which can cause nausea and it can cause abdominal pain. And so he figured he'd start me on a prescription for that, and I thought, I'll try this prescription and we'll see where it leads us.
In addition to medication, the doctor advises Carly to keep her stress in check, as it can trigger bouts of acid reflux. He also asks her to change her diet.
No fried, fatty foods, spicy foods, acid foods, things like that that would trigger it. Caffeine, alcohol. I did eliminate from my diet to try to help myself.
She was the one person on the team who you could put a plate of food or a donut in front of her and she wouldn't touch it, because it just didn't make her well.
Carly diligently follows the doctor's orders, but all to no avail. Each day, she struggles to manage seemingly random bouts of nausea and excruciating abdominal pains that seem to come and go at will.
I would drive around with a bowl or something that I could throw up in, and I would have that with me all the time.
Still, Carly manages to keep it together as best she can, until one day at work when everything changes.
I was feeling pain, I was sweating, I was having hot flashes, I was feeling incredibly nauseous. I had a garbage bag right there ready to go because I felt I needed to throw up. The last thing I remember was the stars, the bright stars going in my vision field, and then the blackness.
Over the past 3 months, Carly Eichout has been suffering chronic bouts of nausea and crippling abdominal pains. Then, when she least expects it, a violent pain like she's never felt before literally knocks her unconscious.
She was nervous, just in so much pain. You could just see the pain in her face, and because she's such an even-keeled person, to see her like that was really tough.
Sue and a few other colleagues put Carly into a car and rush her to the closest emergency room. On the way there, she regains consciousness and asks if someone can contact Nathan, who's out of town on business.
Some of her teammates went and called Nathan to try and get a hold of him.
I just couldn't believe that it was going on, really.
Nathan was like 150 miles away, and he couldn't be there for her.
Within minutes of her arrival at the ER, Carly explains the bizarre series of attacks to the on-call doctor. He immediately performs an ultrasound and discovers abnormal amounts of fluid floating freely in Carly's abdomen.
I was very scared. My first thought was my appendix is ruptured, and if they don't get to me in time, that could kill me.
But nothing could have prepared Carly for the doctor's diagnosis. He's confident that she's suffering from a ruptured ovarian cyst.
That kind of came out of left field for me. I hadn't really thought of my problems being related to any type of female reproductive issue.
Ovarian cysts are small fluid-filled sacs that commonly form in the ovaries and usually go away on their own. But in some cases, they can spontaneously rupture, causing severe pain. The doctor gives her a prescription for a round of antibiotics and recommends that she follow up with her gynecologist immediately.
I was really worried for her, because I didn't understand really what was going on.
2 days later, Carly meets with her gynecologist, who is very concerned about the constellation of symptoms: chronic nausea, excruciating abdominal pain, and now the ruptured cysts. She's concerned that something serious is going on and recommends that they perform exploratory laparoscopic surgery right away.
That was a major surgery to me, so I was very, very nervous. I just needed to be brave.
3 hours later in the OR, the surgical team confirms that Carly did indeed experience a ruptured ovarian cyst, and that she is in fact suffering from endometriosis, a condition which occurs when tissue inside the uterus grows into the pelvic cavity.
I was just shocked, more shocked than anything else.
The surgeon successfully removes the endometrial tissue, but he explains that the condition could return at any moment. And most concerning to Carly is a very real ramification of endometriosis: infertility.
It's shocking to hear a doctor sit there and tell you you might not be able to be pregnant.
Once I heard that, I was a little bit upset, but I probably didn't show it as much as I really was feeling at the time.
For Carly to not have children was just devastating to her.
And as bad as it is, it's an answer, and that's what I wanted, and now we can take steps forward to correcting it.
The doctor promises Carly that the surgery should begin to alleviate her nausea and abdominal pain. Over the next month, she patiently waits for the symptoms to subside. But it soon becomes clear that nothing has changed.
I got back into my normal routine of feeling nauseous most of the time and having this pain come in and out of my life whenever it felt like it. I was very disappointed and wondering, why me?
Carly and Nathan do their best to move on with their lives. But over the next few months, Carly's health takes a nosedive. In addition to the unrelenting nausea and abdominal pain, a new and embarrassing symptom sets in.
I felt these urgencies to go to the bathroom. And I would try to go to the bathroom and I would either have really loose stool or nothing. And that urgency would come and go just like the pain would come and go, and it would catch me at the worst of times. I would be shopping and all of a sudden I'm leaving my cart in the middle of the aisle and running to find a bathroom.
Carly is at her wit's end, but her frustration quickly turns to fear when she makes an alarming discovery.
I had a bowel movement at home and looked in the toilet and there was blood. I was terrified. And it made me wonder if there was some type of internal bleeding happening.
In a state of panic, Carly races to see her gastroenterologist. Concerned, he orders a battery of tests in an effort to pinpoint the source of the bleeding.
Within 1 week, I was at this hospital every day for a different test.
For the first time in a year, Carly begins to feel as if they're finally zeroing in on an explanation. But nothing could have prepared her for the doctor's final verdict.
The doctor said, everything's normal and you need to deal with your problems. I was losing hope that I wasn't gonna find out what was going on and that I'm just gonna look like this crazy person trying to find out.
I wouldn't say right to her face, but on other conversations with other people where I'd call her a hypochondriac.
Ashamed, Carly does her best to hide her condition and move on with her life.
So I went into my own little world and didn't share a whole lot with him for that reason.
It felt like it wasn't even the same person that I knew 4 or 5 years ago. It was tough.
Over the next 4 years, Carly continues to check in with a variety of specialists: gastroenterologists, gynecologists, holistic doctors, and psychiatrists. And each and every time, she hears the same thing. They attribute her symptoms to acid reflux and endometriosis.
I always heard the same thing from the doctors, that my stress and other things were triggering the exasperation of these conditions and that I need to learn how to manage the stress. It would make me furious. How am I doing this to myself?
It seems to Carly as if no one can grasp the severity of her situation, including the person she counts on most, her husband.
I definitely started to feel Nathan and I drifting apart. We were physically together, but emotionally we weren't talking about anything at all, really. And I was pretty much feeling bad all the time, not feeling like doing anything.
Wasn't too sure at the time what was going on, whether she was sick or just wanted to be alone by herself or what.
It was very hard. I felt very alone. I didn't want to see us fall apart at all. I just didn't know what to do.
Over the past 4 years, Carly Eichhout has learned to live with chronic bouts of incapacitating nausea and crippling abdominal pains that no doctor can explain. But now, her already fragile body seems to be taking a turn for the worse.
I was literally sleeping on the bathroom floor because I was throwing up so much. There was no letting up of that pain.
She'd spend more than half a day in the bathroom, nauseous and throwing up.
Carly's sudden deterioration is a wake-up call for Nathan, who has never truly realized the severity of his wife's bizarre condition.
I was definitely worried about her.
He was consoling me. He'd be there holding my hair, rubbing my back. He very much started trying to be that person I wanted him always to be.
Over and over, Nathan begs Carly to go back to the doctor.
Because I thought it's a waste of time, it's a waste of money, and they're just gonna tell me the same thing. They're gonna run some blood work, they're gonna do a few exams, and then they're gonna give me a prescription and they're gonna send me home. So I was trying just to deal with it.
Then, in May 2007, Carly's pain and vomiting becomes so bad that she's unable to eat or drink for several days. Finally, she breaks down and calls Nathan, who's out of town on business.
She called me and told me that she was on the floor in pain, and I told her to call an ambulance to go to the emergency room.
15 minutes later, paramedics arrive and race her to the hospital. Emergency room doctor Curtis Henderson takes over the case.
I was working in the emergency room. Carly had come in as a patient complaining of abdominal pain. With abdominal pain like that, you have to think of things like gallbladder problems. You have to think of intestinal issues, large and small intestine. You even have to be concerned a little about their lung or about their heart. We gave her some IV fluids, and we started blood work to see if anything in her body would manifest itself as abnormalities in blood work.
While Carly anxiously awaits the results of the blood tests, Nathan drives as fast as he can to the hospital.
I was worried really, really bad. I didn't know whether it was, could be fatal or not. I was definitely worried.
He was very much trying to be my sounding board and trying to be calm.
An hour later, Carly's blood work results come back, and to everyone's shock, they are perfectly normal. Perplexed, Dr. Henderson orders an abdominal X-ray and ultrasound, and the results are again surprising.
Basic X-rays and ultrasounds were all normal. So because of that persistent pain, I decided to get a CAT scan of her abdomen to see what it would reveal. It was really a mystery.
2 hours later, Dr. Henderson receives the CAT scan report, and this time, it's a bombshell. After so many misdirections, a quick glance is all it takes to pinpoint what's been plaguing Carly all these years.
Based on a CAT scan, I knew Carly had intussusception.
Intussusception is a rare condition where the small intestine telescopes into the large intestine. Normally, the two sections of intestine remain separate, but in patients like Carly, they become intertwined. This telescoping eventually obstructs blood flow to the small intestine, slowing down digestion and causing bleeding. If not treated, the bowel can become gangrenous, and in the worst cases, lead to death.
In very simple terms, if you think of a pirate's spy scope and how it telescopes in and out, the small intestine folds into the large intestine, and what can happen, the large intestine can actually cut off the blood supply to the small intestine. It makes people vomit, and it causes a lot of pain.
It sounds kind of weird. I was happy. I was so happy that I'm not crazy. And I remember even saying that to Nathan, saying, I told you so. I told you something was wrong.
I was just beside myself. I didn't know what to think.
As it turns out, Carly's endometriosis was just a coincidence and didn't have anything to do with the intussusception.
Intussusception is truly an emergency. I've only seen intussusception 2 other times in adults. It's much more common in infants. When tissue in the body does not get adequate blood supply, the tissue disintegrates. It gets infected, and that infection can go throughout the entire body and cause death.
I was just kind of in shock.
With no time to waste, Dr. Henderson explains that before they can treat her condition, they have to find out what's causing her intestines to telescope in the first place, and the possibilities are terrifying.
There was some thought that there was a tumor involved. A tumor in that area can cause intussusception.
It's imperative that Dr. Henderson get a close look at her intestines. He immediately schedules surgery. Carly can barely process it all.
I did get nervous, and so I was very much, doing some praying and telling myself positive thoughts.
At 6 o'clock the next morning, the medical team rolls Carly into the OR. As Nathan kisses his wife goodbye, he struggles to keep his emotions in check.
I was nervous, anxious, anxiety, just everything just wrapped up and just so many things kind of going through my head. What if, what if?
Inside the operating room, the medical team begins the delicate surgery.
The surgeon made a cut just above the belly button and went in to evaluate the bowel.
First, they painstakingly examine every inch of Carly's intestines, looking for any form of obstruction. It's an intense process that takes more than 4 hours. Eventually, the surgeons do identify a single growth. They then correct her telescoping intestines and remove the tumor, which is immediately sent to the lab for evaluation.
I was definitely worried it could be cancer.
5 hours later, the findings are in. The tumor is benign.
Very happy news. We were both just like holding each other, so happy.
And while Carly and Nathan are thrilled to finally be out of the woods, they can't help but wonder why it took so many years to get a solid diagnosis.
A person can have transient symptoms, but no one can find out the problem because it goes away. In this kind of intussusception, you can actually have a sliding in and out of the small intestine into the large intestine. And in Carly's case, it's very possible that it just got stuck this time, and we were able to catch it.
After 9 days of recovery, Dr. Henderson releases Carly from the hospital. And for the first time in years, she finally feels like her old self again.
I was eating, I was drinking, I was happy again.
She just seemed like a whole different person. She wasn't nauseous anymore after that. It wasn't the same old Carly that I knew, but it was just a new Carly, a better Carly.
And just when she thinks it can't get any better, Carly is thrown for another loop. 2 months after the surgery, she's shocked and elated to discover that she's pregnant.
I was so happy, and we were both crying. We were just over the moon about it.
Today, Carly is healthy and focuses on spending time with her husband and raising their son.
Life is good. Like, life couldn't be any better right now. We've got a beautiful baby boy.
We are much stronger now. Having been through all that, we're absolutely happy again with each other and committed to making a good life for our son. So I couldn't be any happier now. I feel normal again.